so many pieces to make something like this work.
Thank you guys for being here this morning. This has been a huge endeavor.
This was a first. There wasn't a predicate for us to look at and say, wow, well, they did it that way, let's do the same thing and copy it.
We want to be a premier EMS system, and one of the best ways that we can do that is through education and training. These mannequins are obviously plastic and simulated tissues. It's nothing like real human tissue in any way, and it just takes away from the experience, honestly. We're not able to simulate drastic differences that occur.
There is no simulation model or simulated or manufactured tissue that approximates what you can find with a cadaver when it comes to the realism of performing a procedure.
We've partnered with Austin Travis County EMS to provide an advanced anatomical course.
Founded by the pec, lat, axilla.
Basically, you're going to see major organs.
While you are doing this, your patient is dying.
Blood vessels.
Truly, this is a surgical emergency.
Nerve bundles.
So everybody kind of feel that.
All kinds of things.
Practice your incision.
Maybe read about or seen pictures of in books.
So let's take a look at the exterior chest real quick.
We're hoping that you'll get a better understanding.
Yeah, get in there and just bend it.
Like the human anatomy by looking at it.
How quick can you do that? Yeah.
In person.
Most of them I've learned
It'll be an unmistakable feeling.
in a book and on mannequins, but this was the first time that I've ever had a chance to do them on human tissue.
You got to use an instrument to get through there.
At least one of the procedures was brand new to me.
What we do in the field is a little bit different. It's a little bit less predictable. We don't have as much
That's a normal airway depth.
equipment or hands available, and we have to be able to do it right the first time, every time.
Okay, so right where we need to be.
The truck is our office. It's a mobile office. And when we get into the back dealing with the patient, sometimes just crawling all over each other, and it's just what our job is like. A lot of the cadavers you're dealing with are more like our patient population we're going to see.
It's big, it's huge.
Some of the mannequins don't have the body weight or mass that these do. You go to move one part and the entire thing moves. That's not how a human actually works. You have a cadaver back there, you go to manipulate the head to adjust for the airway, and you're actually dealing with the stretcher you're really going to be on, standing inside a unit you're really going to be in. It's as real as it can get
And go.
without being on an actual call.
My goal is to make this an industry standard.
Any tension that's in here will vent immediately.
I want EMS systems around the nation to look at Austin Travis County EMS and want to emulate what we're doing.
I'm sure that it gets much bigger than that.
Honestly, when you do donate your body to science, what you've done is in essence extended your life to be able to extend other people's lives.
This is a very compassionate donation on their part. This is incredibly valuable training. Dissect up towards his head.
They have certainly helped us in treating patients in the future.
If I take a look at this, what is this thing, this kind of bulbous tissue here?
When they actually go to do it on a patient, they're going to have more confidence and they should have a much higher success rate.
What could we do? How could we help with that?